Hey guys, it's Dr. Workman with Traditional American Medicine. I'm here with Dr. Sample, who has been having some sinus issues. So even though he's not feeling well, I'm taking advantage of it as a perfect opportunity to show you osteopathic manipulation treatments, or OMT, for patients that come into our office who are having similar complaints, sinus issues, sinus infections, anything where we need to drain out those sinuses. We're going to show you how we do it in the office. So
I've been waiting for this all day.
He's really excited, so we're just going to jump into it. I'm going to start by taking your glasses from you. Thank you. And have you lay down here. I'm going to take your bandana. I promise to keep it safe. And I will give it back to you when we're done. So whenever I'm looking at someone with sinus issues, then I actually want to start with the back of the head. So I'm going to go to the back of the head, down where it meets the neck. And I'm going to look for any areas that might be tender.
Oh, it's sore there.
Yeah, that's a sore spot. It feels pretty tight under my fingers. And my goal is to try and loosen that up. Because your vagus nerve comes out of here, and your vagus nerve, it feeds a lot of different parts of your body, but the important thing here is it kind of can send your sinuses into overdrive, and we want to settle that down so you're not producing as much mucus, and it's helping your body kind of jumpstart that healing process.
Like, it still hurts. It's like a good pain.
Yeah.
Like, it feels like it's getting stretched out. It feels
Yep.
good.
Yep, my mom calls this a neck melt because she feels like her head turns into butter and is melting over my hand, so that's what I tell patients. It's like a neck melt. All right, that feels better under my hands. Does that feel better to you, tenderness-wise?
Yeah,
okay,
yeah.
Perfect. Okay, so the next thing I want to do is kind of unblock the fascial tissue that we kind of consider it like a dam, like a beaver dam, and you have to release that dam in order for the water to flow freely. And if the water in this case is your lymphatic system, which it helps with healing. It also allows the congestion to drain, all of those things. So the main fascial plane that we're targeting is going to be right here. So that's different than muscles and bones. There's a lot of things that we manipulate with OMT. Fascia is one of them. And if we treat it in multiple planes, you find the area where it's restricted the most. And then you want to unwind that. It's kind of like a tangled spider web. You got to unwind it so that you can have your lymphatics flow through there. That feels better to me. You can't really feel that yourself, but the important thing is once it's opened up, you can drain more freely. So I'm going to do that. And then I'm going to move on to starting to drain some of Dr. Sample's sinuses. So I start with the bottom and work my way up because I was taught that you don't want to, pour water into a clogged sink. So that's why we opened up the dam. And now we're going to work our way back. So the first area I'm going to target is the eustachian tubes that runs from your ear to the back of your throat. And I'm just going to kind of encourage that mucus or fluid to start flowing downward. Some people notice this right away.
It feels a lot better now that you've opened this up.
Yeah.
Because usually, like, everything feels just like it's just stuck in my face and my throat, and like my neck doesn't want to move. But once this is opened up, like, things can actually move through.
A lot of this we do to ourselves even, and I'll teach patients to do in the office, but opening that fascial plane, you can't do on your own. I haven't figured out a way to do it anyway. The rest of this helps, but if that's not done, it's pretty difficult. So again, I'm just doing the same thing on the other side. It might be a little harder to see, but just from your ear at the base of your jaw all the way down your neck. Okay, and so I'm going to do that on both sides. Try and get any fluid that might be in your ears. If your ears feel muffled whenever you get a sinus infection, or any sinus congestion, that's what I'm trying to encourage to go downwards. Another thing that I do for the ears is I check to see how the temporal bone, which is a skull bone, how it's moving. And you have some restriction actually on your left side. So has your left ear been bothering you more?
A little bit.
Okay. So that makes sense. So I'm just kind of tug on his ears, open up that area, that eustachian tube, just a little more to drain.
And now I can really tell the difference.
Yeah, it feels like when your ears pop on a plane almost, it opens up a little more.
There's like other things that bother me, but until you pointed that out.
All right. And it feels better to me, so hopefully, that'll continue to be open for him so that can drain down. The nice thing for our patients, too, is Osteopathic Manipulation Treatments, you can come in. If you're a member, you get unlimited OMT visits. So if you're feeling good today, but in a couple days you need me to do another round, come in. We'll get it started, okay?
Starting to drain.
Yeah, it drains the back of your throat, so you are going to have a tickle in the back of your throat. It might make you cough a little more, but that means that it's working. So then I'm just going to, it doesn't matter what order I do the face in necessarily, but I'm going to start trying to drain these sinuses, encourage the mucus to go out. So starting with the frontal sinus, I'm going to put my thumbs in the center of his head. I'm going to push out and down. Got to get that mucus moving. The frontal sinuses are under the forehead, so that's where I'm targeting right now. Good. And this is something you can teach patients to do on their own, but again, at least the first time, it is definitely helpful to have Dr. Sample or myself do this in the office. So you're trying to encourage the frontal sinuses to drain down. And then we want to go to the maxillary sinuses, which is under your cheekbones. So I'm going to put my thumbs on the bridge of his nose. Go down and out. This is just encouraging that fluid to move.
It's a lot better when you do that.
Yeah, it's really opening stuff up. Some people will do around the chin. I don't know what sinus that targets, so I don't always do that. I'm not going to do it today. And then we also have what we call trigeminal nerve stimulation. So you're just kind of finding the places where the nerves exit the skull and give them a little wiggle. And what that does is it helps those nerves, when they travel through the sinuses, kind of stimulate that mucus to thin out. And there's ones by your eyes. There's ones in your cheeks. I'm going to do this on this side so you can see. This is hard to do on your own as well.
Sore.
Yeah, they get sore, especially when you're having sinus pressure. But this will hopefully break it up a little bit. And then Dr. Sample does a couple that he's taught me that I didn't necessarily learn at medical school, but I definitely use in my practice. We teach each other all the time new tricks of the trade, so to speak. So one of them is to put my fingers on either side of his nose here. And just kind of bounce back and forth. And again, the idea is to try and encourage the mucus to start draining. Okay. And then I'm going to make a little vacuum in his ethmoid sinus, which sits a little deep. It's kind of hard to target with just what we call effleurage, with my squeegee motion. This one I got to make a little vacuum and try and open it up so it can drain a little better. You feel that one start to drain?
Way more on the left. That's really clogged.
Yeah, that's the side where your ear was feeling worse to me too. So the left side was definitely more congested for him.
Okay. You can feel it opening up.
You can feel it open. It really feels like a vacuum. Like
all that mucus there. It's funny how that vacuum.
Yeah. All right. How are you feeling with that?
Good.
Okay.
Like I said, some of this is it's a pain, but it's a good pain. It feels better the more we press on it.
Yeah, especially if you're sore. If your sinuses are sore, then it's going to be a little tender when we start, but it's not. It's a good pain. It's like a good stretch kind of a thing. Okay, so I'm going to end with that today. I'm going to give you back your bandana and your glasses. Now, some patients, when you mess with their ears, they get a little bit dizzy sitting up, so I take your time sitting up, especially when you have all that congestion in there and then it releases.
I just pop up on my bed.
Do as he says, not as he does. But overall, do you feel like your sinuses are draining a little bit better?
Yes.
Yeah. I mean, we do this to each other whenever we're sick. It's something we want to do for our patients as well. We really do believe that it is beneficial. And again, the goal is to get your body to its maximum potential for healing itself. So I'm not doing anything that your body can't handle. on its own. I'm just speeding along the process and giving it that kind of jump start that it needs.
Well, the best part is this is stuff that you can show people. They can do it at home. Like, we'll do this in the shower all the time. You press on your maxillary sinus, frontal sinus, your maxillary sinus, really opening that area up. So it's stuff you get to take beyond the office.
Yeah, and if you're someone who has kiddos at home and they're having sinus congestion, we have tricks of the trade that we can teach you to help them as well. So some of it's this. There's other things that are targeted.
Preventive before it starts.
Yeah, to try and get things moving before it turns into an actual sinus infection. So we'll get things moving, and then you can do it at home for you and your loved ones, which, you know, is, we're all about giving our patients value. We want you to be able to use these things. We want you to be able to do them at home, but we're also a text or a phone call away. Our patients have our phone numbers so they can call or text us 24/7. They get unlimited OMT visits. They can always come into the office and we can help them drain their sinuses, kickstart that process. But yeah, it's something that is definitely a benefit for our patients. If you're not a patient yet and you think that this is something that you would be on board with, check out www.traditionalamericanmedicine.com. See how you can schedule a pre-enrollment interview. Ask us more questions during that interview, and we will get you signed up, get you started so you can start benefiting from this too, just like Dr. Sample did today. So
I love being the example
patient. Everyone loves being the example patient. It's always the best spot to be in. So we hope you learned something today. Feel free to reach out to us if you have questions, and we look forward to working with you. Bye.